Welcome back. Thom Hartmann here with you, and very pleased to have on the line with us Wendell Potter. He is the former executive in the health insurance industry, senior executive in one of the biggest healthcare companies in the country. He's the author of Deadly Spin and Nation on the Take. His latest project is tarbell.org, Tarbell.org, examining the impact of money in politics on millions of Americans. And also his website, Wendell Potter, you can find him at, and you can tweet him at Wendell Potter. Wendell, welcome back to the program.
Thanks so much, Tom. Glad to be back.
Great having you with us. I am looking at this somewhat bizarre situation with, I'm increasingly calling it chump care. Trump doesn't want his name on it, and really anybody who advocates it, or anybody, any average Republican who thinks it's a good idea is being made a chump of by Paul Ryan. I mean, you've got this story in the Intercept by Nick Sergi back on March 9th, hours before House Speaker Paul Ryan held a press conference to sell his health care overhaul legislation. He was doing something he's much better at, fundraising. And here he's at this breakfast fundraiser with McGuire Woods, which represents Blue Cross Blue Shield, which paid them $120,000 to lobby on changes to these, And so Paul Ryan is basically taking all this money from the health insurance industry and doing fundraising there. Does that have something to do with why the industry is going to make out really well and 24 million Americans are going to get screwed with Ryan Care?
I think so. I think you're exactly right. I think there's definitely a connection there. And one of the things I'm going to do with Tarbell, by the way, is to help docs just exactly like that, to help them understand how things like that happen and how it affects their daily lives. But that's, one thing that you're probably noticing is that the health insurance industry is staying really quiet about this. And they're doing that because they realize that if they get out and endorse it, that people will be suspect and realize that they have a lot to gain. So they're just kind of sitting on the sidelines, helping them behind the scenes, and certainly egging them on, but not out there publicly. It really would be a benefit to most of the insurance companies. There's no doubt about it. And most importantly, to the big insurance company CEOs who will get a huge tax break. And what we would see overall, Tom, is also, and it's kind of ironic, a big transfer of money from red states and from poor people in those states to people, and I say this is ironic, in New York on Wall Street and other places where there are clusters of very wealthy people. They would be the ones to benefit, and the people who would be most disadvantaged would be the people who are the ones who, quite frankly, were the base of the Trump supporters.
Yeah, the blue states are the maker states. They pay more in federal dollars than they get back. The red states are the taker states. They're basically all on welfare from the federal government. They get back more money than they pay in. And those are the states, the red states, are the ones that are going to get whacked the worst by this.
Absolutely.
And the blue state people in the blue states are going to get tax breaks. It's pretty bizarre. I'm thinking increasingly that politically this is not viable, and Donald Trump has not embraced this aggressively. He's merely given it kind of lip service, and he's been letting Paul Ryan sell it. And Paul Ryan couldn't sell himself as vice president. And I think most people don't realize that the main job of the Speaker of the House, or at least the key to his power, is that he passes out and he raises enormous amounts of money and he passes it out to other members of Congress to get them to do what he wants, including voting for him every year or every other year as Speaker of the House. And
That's right.
and where's the money? It's with the health insurance companies right now. I mean, hundreds of billions of dollars.
Oh, exactly. It's enormous sums of money because these companies would benefit greatly. They don't. And Tom, here's something that's very important too. Insurance companies don't care for people who have to get coverage on the individual market. They couldn't care less for them. The main customer for these big companies are employers, but who they have most allegiance to are their shareholders and to the Wall Street financial analysts. They're the ones that they really care about. When I say they don't really care about the individuals who have to get coverage in the individual market, they're not part of an organized group necessarily. And they are the people that the insurance companies have excluded from coverage over the years. So they would just as soon go back to the days where they can say, thanks, but no thanks, we don't want to cover you anymore.
Right. And this would certainly make that happen. So what's your sense, what's your spidey sense on this? What's your political sense of how this is going to play out?
I don't think it'll get through the Senate. Ryan may be able to get it through the House, but I think that there are more reasonable heads will prevail in the Senate, even in the Republican Party. There are some members of the Republican Party who they probably have to admit it, but they're really more moderate than a lot of their colleagues over on the House side. And I think they also understand that if this were to go through, it would be on their hands. I mean, they would own it, and there would be a lot of people. 24 million, I think, is underestimating the number of people who would lose coverage, and the coverage that they would get. Those who remain covered, it would be less valuable coverage. They'd be on the hook for paying more for their medical care. It just is not tenable. And I think that a lot of members of the Senate would just come to realize that and wouldn't let it get through.
We had a woman call last hour who had been paying a couple $100s a month religiously to a health insurance company, and so that she would have health insurance. She thought she had health insurance. She was diagnosed with breast cancer, and when she made an appointment with her oncologist and went to the hospital, she discovered that her health insurance, in quotes, didn't pay for any of this stuff. And she ended up having to go with the Texas high-risk pool. And what are these plans called, these phony baloney plans where people think that they have health insurance, but once they get sick, they discover that they don't? And didn't Obamacare outlaw these? And will the repeal of Obamacare allow the health insurance companies to start offering these scam plans again?
Yes, absolutely. They were made illegal by the Affordable Care Act. There may be some out there that are sold illegally, but they would return, and that's exactly what happened to so many people. They were lured into these plans. They lure people in with relatively lower premiums. People think that they're getting a good deal. Think that somehow they've looked into getting coverage that is affordable when it's just snake oil. They realize when they really need care, especially expensive care like chemotherapy or radiation, that it's not going to be there for them. It is just so callous, and that's why so many of these companies, when I say they couldn't care less for the individual market. They don't really care for the people who enroll in their plans in many cases. It's all about the money.
Mm-hmm. Yeah, and this is the rot at the core of American politics and frankly American business as well. Wendell Potter, former health insurance industry executive, author of Deadly Spin and Nation on the Take. His latest project is tarbell.org. Check it out, Tarbell, which looks into the impact of money on politics and millions of Americans. You can tweet him at Wendell Potter. Wendell, thank you for being with us today.
My pleasure, Tom. Thank you.
Always great talking with you. We'll be right back.